Oh, hi, I'm Garcia Murillas. I'm a staff scientist at the Institute of Cancer Research in London. So next Personal is an assay that is designed to identify molecular residual disease. That is small traces of circulating tumor DNA in the blood.
So at ASCO, we have a collaboration that we've done with some world experts in breast cancer, Dr. Isaac Garcia Murillas, and also Dr. Nicholas Turner at the Institute for Cancer Research in London and the Royal Marsden. We did an amazing study with them that shows how the next personal test is able to detect traces of cancer, the earliest traces of cancer in the blood of these patients, almost 15 months ahead of what you would detect with imaging.
So in this retrospective proof of principle study, we recruited 78 women. These are early breast cancer patients representing all the subtypes. And we analyzed 619 plasma samples with a median of 8 samples per patient. So using Next Personal DX, we identified molecular relapse 15 months, with a molecular relapse with a lead of 15 months of a clinical relapse, with a range of 4 months to 41 months. Now that represents an increase of the current technologies using digital PCR or full exome sequencing that reports between 8.9 and 11.7 months lead time of a clinical relapse. Patients with no circulating tumor DNA detected either post-surgery or at any time point during follow-up, and none of these patients went on to relapse, which saw the highest specificity of the assay. These patients were followed for around 5 years. So using Next Personal DX, we found that the detection at baseline was increased in comparison to current technologies. So current technologies report between 51 and 84% detection rate. With Next Personal DX, we identified 98% of patients with a baseline sample.
What that means for a patient is if you get a negative result on our test, they can have a lot more confidence that they are indeed disease-free, free of cancer. And for patients, that's incredibly powerful because in the cancer patient journey, there's a lot of uncertainty that patients deal with on a daily basis. And one of those is, do I have cancer still? Is it coming back? And if it's coming back, can I treat it? So having that negative result to reassure them that they are still disease-free can be very helpful for those patients.
We need to run more prospective interventional clinical trials in order to see if this detection is going to affect patient outcomes. Where I see Next Personal DX potentially making a difference, and this is due to the sensitivity and the specificity of the assay, is in the escalation studies. So it's in these studies in which you have to be 100% sure that the patient doesn't have circulating tumor DNA detectable before you can de-escalate treatment. Now, if you have a patient through clinic and you have this type of test with a negative result, you could potentially inform the patient that there is no DNA from the tumor present in circulation, so it seems to be that the cancer is gone away. But on the other hand, if you have circulating tumor DNA detected, you could tell the patient that there seems to be some micrometastatic residual disease left, which will mean you could intervene earlier, either with a targeted therapy or with a standard of care.